Hello everyone, how are you? Hope all of you are fine. Thanks for supporting my channel. Today I will show you a knee joint MRI case. This is a female patient having a history of twisting injury to right knee. So here the MRI was done and few important findings are visible in this knee joint. If we look at the T1 weighted coronal image, if we see the normal structures, here we can see this is the lower end of the femur, this is the lateral condyle of femur, this is the medial condyle, here is the upper end of the tibia, here we can see this is the upper end of the fibula. Here the meniscuses are located in this position. Here is the lateral meniscus and here is the location of medial meniscus. If we look at the T2 weighted sagittal image, here we can see this is the location of posterior cruciate ligament and this is the location of anterior cruciate ligament. We know that the anterior and posterior cruciate ligament gives the stabilization of the knee joint. As the patient is having a history of twisting injury, so we need to look very carefully for any injury to these cruciate ligaments. Okay, first of all, if we look at the medial condyle of the femur, here we can see there is irregular hypointensity in the subchondral region of the medial condyle of the femur. It is suggestive of subchondral insufficiency fracture. And if we look at the course of the anterior cruciate ligament, here we can see the apparent midpart are diffusely thick and partially ruptured, involving less than 50% of its fibers. And also if we look at the posterior aspect of the knee joint, here we can see this is a fluid intensity area at the posterior aspect. If we look at the T2 weighted axial image, here we can see more clearly there is a fluid intensity area at the posterior medial aspect of the knee joint in between the medial head of the gastrocnemius and the semimembranosus tendon. So this fluid intensity area is suggesting of Baker's cyst. And if we look at the meniscus, here we can see this is the location of lateral meniscus and this is the location of medial meniscus. For better visualization, now we will look for proton density weighted image. Here we can see the lateral meniscus is very nicely visualized here, but the medial meniscus at the posterior horn, there is tear within the posterior horn of the medial meniscus. The part of the meniscus is displaced medially towards the intercondylar area. So in summary, we can see in this MRI image of the knee joint, we can see there is subchondral insufficiency fracture of the medial condyle of the femur. There is tear in the medial meniscus and there is Baker's cyst. Thanks for watching my case. If you want to get this type of important MRI cases, please subscribe our channel and press the bell icon for getting notifications about the new uploads of videos in my channel. Thank you very much.